Can you all discuss post-COVID-19 care for those patients that have had a prolonged hospitalization? Dr. Hurst, do you want to take that one?
So, this is a very broad question in regards to post-COVID care because a patient it really depends on where they fall in the spectrum in regards to their degree of respiratory failure and their pre-existing conditions. It is not uncommon for, a patient to have severe respiratory failure requiring high flow nasal cannula for a couple weeks, and then they have the opportunity to de-escalate that oxygen support, and they're able to go to subacute rehab or go home with little to no requirements. And that's on the great end of the spectrum. And then we have our patients who've had prolonged hospital stays that, they're in the hospital for 60 or 80 or 90 days with multi-organ failure and are newly dependent upon machines to keep them alive. And so managing their post-COVID illness, I think, is akin to how we manage some of our post-ICU illness. It's going to be doing our best to ensure that early physical therapy is initiated during the hospitalization to reduce the stress and strain on the patient's body post as their hospitalization is winding down, ensuring that we are having clear conversations with our family members about their goals and wishes. As Dr. Davison mentioned early on in our talk, if we know who we're going to put on vent support, it helps us, or if we know, if we have a clear discussion with palliative care about how to manage patients, it may ultimately change their outcomes in the future. And so this is going to be very patient-centric in regards to how we manage post-COVID care. I think one thing that's important to be conscientious of is the fear that our family members face, as well as our patient faces, after they've had this severe traumatic event of being hospitalized for COVID pneumonia. And if we can ensure that they have the right resources, as well as good education about kind of how to re-enter life after being exposed to COVID, is going to be helpful for our family members, so they can know, when can I get back to work, when can I socialize again, as those things are often paramount to our humanity.